guys, welcome back to my channel. It's me again, Mama RN, and now we are gonna talk about the day-to-day routine of an endoscopy nurse. Ayan. Pasensya na, medyo congested ako. So time to time, medyo mag-clear tayo ng throat or iinom ako, okay? So this time, I'm gonna talk about ano ba yung day-to-day routine ng isang endoscopy nurse. So, my day starts at 6:30 a.m. and ended at 4. So, I work 4 days. I have 1 day off. So, meron akong 3 days kasi weekend and then 1 day off. No. So, 6:30, in the morning, usually it's either ahead of time, yung shift coordinator namin, does the scheduling already. So you would know where are you going to be assigned. Okay, so again, as I've said, you can be rotated anywhere. You can be rotated in pre-op, post-op, or outside the room, or in the room as scrub nurse, or circulate, or in the pain room, or in the bronch. Okay, so, or ikaw yung charge. So, ayan, malalaman mo kagad kung ano yung assignment mo for that day. Okay, so 6:30, we usually do huddle first on what's going on for the day. So, say, you are going to be outside, pre-op, post-op. We have this number of cases, say 10 cases for the day with Dr. Blah blah, and we have 1 room running or 2 rooms running. It depends on how many doctors ang gagawa ng procedure. So, it depends on how big your hospital is and how many rooms ang kinikater ng hospital nyo. So, ayun. So, sabihin nga na, say, sinabi na sa akin na ako yung pre-op, post-op for the day. And then, after, it's a very brief meeting just to give everyone overview on magiging busy ba tayo, how many cases yung ina-expect natin for today, ganyan. Okay, so pre-op, post-op, usually ang patients ay ina-expect to come in, say, we usually start as early as 7 a.m. and they are expected to come in an hour and a half. So, kung 6:30 pa lang, andyan, 6:30, 5:30, yeah, 5:30 or 6, andyan na yung pasyente. Okay, may pumapasok sa amin ng 5, pero yung pasok ko ay 6:30. Okay, so may opener, may closer na tinatawag. Okay, so, ayun, so if ako yung nasa labas, ako yung pre-op, post-op, hindi lang ako specific for pre-op, hindi lang ako specific for post-op. Nagtutulungan kami. We do pre-op and post-op at the same time. Or hati, diba? Kung, depende kung anong mauna, may dumating bang pasyente or walang pasyente, at meron tayong natapos na procedure, yan. So, it depends. As pre-op nurse, what do you usually do? So, ikaw yung kukuha sa pasyente dun sa waiting area, and then history taking, review of medications, allergies, metals in the body, yung mga protocol sa hospital nyo. And then, you will prep the patient, mag-change ng gown, insert ng IV, mag-place ng blood pressure cuff, cardiac monitor leads, what else? Ayun. So, yun yung pre-oping. And then, once you're done with pre-oping, also sometimes then guys, you do the pregnancy test. It depends kung may i-order na anything like blood test dun sa patient na yun. Okay. Critical for the pre-op nurse is to make sure that they are following their prep, either NPO, bowel prep, how their bowels are, diba? Yun yung important with the pre-op. Now, once the pre-op nurse is done prepping the patient, doctors will get their consents for the procedure. And then, once they're ready to be in the room, the circulating nurse will get the patient. Then, i-check yun, i-validate lang yung mga information na ginawa ni pre-op, and then kukunin na si patient to go in the room. Then, circulator. So, circulator is the one who is assisting everything na hindi nasa field. Ikaw yung taga-chart, ikaw nagre-run ng room. In short, okay? So, as circulator naman, you do your room in, time out, room out, scope in, scope out, labeling ng specimens, runner kapag may kailangang mga gamit or stuff na kailangan ng doktor or ng scrub mo, sasabihin naman yun sa inyo. Okay? And then, you're also responsible to bring the patient back to the recovery naman. Okay? So, that's the circulator. For the scrub nurse naman, scrub is, ikaw yung nagte-tech. Ikaw yung direct assistant ng doktor. Say, need mo to get biopsy, prepping the patient, cleaning the scopes, prepping your field, prepping all the equipments, instruments that you need to use, assisting whatever they need to do, in short, as scrub. Okay? Ikaw yung direct assistant ng doktor. And then, after the procedure, so circulator will bring the patient back to the room to recover. So, doon naman tayo sa recovery nurse. Si recovery nurse ay endo nurse pa rin. Okay? So, umiikot lang talaga kami dun sa mga phases na yon. So, as recovery nurse, you are the one responsible for recovering the patient. So, may mga protocol naman yan, how to recover the patient, to discharge the patient, educating the patient on what to expect, ano yung pwede, hindi pwede, mga medication, the usual discharge, guys, no? Sa bedside, same lang ng discharge. Ang difference lang is what you educate and mga kailangan na ipabaon ba o sabihin dun sa pasyente. That's the recovery. We cater both adults and kids. Unlike sa bedside, it's either you handle adults lang or kids. So, kami, both adults and kids. No? And magkaiba yung recovering ng general anesthesia sa naka-MAC. No? MAC is the usual propofol, ganyan. So, yun ang routine ng endoscopy nurse sa different roles. No? With pain management naman sa amin is scrub and circulate pa din. So, you assist, or you the circulate who does the charting, or running the rooms, no? So, yun yung roles ng each endo nurses. Now, dun sa routine, so say, 10 cases for the day. Sometimes, the cases will run, on average, it's 30 minutes, then 30 to 45 minutes. It depends on who's the doctor and who are the patients. So, there are some patients, or especially for peds, they provide like at least 45 to 1 hour gap. With the adults naman, on average, they do 30 minutes. Yeah. Or 45 if they do like double cases, say endoscopy and colonoscopy. We started at 7 and we have 10 cases. Usually, we're done about 2 p.m. 1 to 2 p.m. It depends on how quickly the procedure will be or kung may cancellation ng cases, ganyan. But, 2 o'clock usually tapos na kami. So, Mama RN, sabi mo hanggang 4 p.m. pa yung pasok mo. So, anong ginagawa niyo sa 2 to 4 p.m.? So, guys, sa procedural, once na done na kayo with all the cases or the procedures, syempre, marami kayong mga daily, weekly, and monthly task na ginagawa sa unit. Like, mag-restock, gumawa ng mga bed packs, restock ng mga IV items, maglinis ng mga rooms. So yon, lahat yon, marami pa rin kayong mga tasks na kailangan gawin. Hindi lang yung role nyo as endo nurses ang ginagawa nyo, but also to maintain the rooms, clean the rooms, restock whatever you need to restock for your supplies. So sometimes, mag-aantay din kayo kung biglaang merong mga add-on cases, ganyan, kasi sometimes they don't know yet kung may add-on. Add-on is kung may biglang inpatient na kailangan ng scoping. Say, from ICU na they're looking at any potential bleeding or whatsoever, mass, that they need some biopsies. So, yun yung mga add-on cases. Okay? What else? We also do bedside procedures. If, say, intubated yung patient sa ICU, we go to the ICU, bring all our stuff, and we do the procedure there. Inside the room, you have your proceduralist or the GI doctor. Anesthesiologist, we have the anesthesiologist to do the anesthesia, then scrub and circulator. We do conscious sedation in our pain room, and that is the trained nurse ng conscious sedation ang gumagawa. What else? Another difference with procedural compared to bedside is pag naglo-low census. So sometimes, say, 6 lang yung cases nyo. So, kung in-expect nyo na, say, yung average is 10 to 12 cases up to 2 p.m., kung say, 6 patient lang meron kayo for that day, alam mo na kagad na matatapos kayo ng maaga. So, pwede kayong ma-low census nun. Low census, sasabihin sa inyo sino yung voluntary na gustong umuwi agad, pwede. Okay? Pero usually, kung sino yung on-call for that day, for that night, usually they're the one who stayed. Kasi, just in case na biglang matawag, sila na yung on-call, no? Or kung sino yung mga nurses na up until 5 p.m. yung pasok, sila yung nagsistay. So, again, pwedeng umuwi ng maaga, pwedeng mag-extend kayo. So, depende yun sa how your charge managers, your hospital scheduled their patients. So, may mga times na meron kaming mga scheduled cases na late, na alam namin na, teka lang, ang staffing natin ay ganito lang. So, malalaman nyo, yun yung kagandahan naman sa procedural na mafo-foresee nyo kagad how many staff do you need for that day, magiging busy ba kayo for that day, 3 rooms running ba, how many patients do we have for that day. That's the good thing with endoscopy. And what I like with endoscopy is very routine, very exciting lang kasi may mga, alam mo yun, ever since I'm fond of looking at our anatomy, yung makita mo lang yung loob ng system ng tao, tas ito pala yung polyps, ganito pala itsura ng mass, ganito pala itsura ng nagbi-bleeding, ganito pala itsura ng may mga varices, no? So, yun, na-excite ako sa ganun. Pero kung kayo yung ayaw nyo ng mga bagay na nakikita nyo na mandidiri kayo, then probably it's not for you. Kasi nga, initially, I want to be in a OR, diba? Pero, gusto kong matry si endoscopy kasi at least nakafocus lang siya sa GI. Unlike sa OR, you have to learn a lot of different kinds of cases, different kinds of procedures. And sa OR, you only do either you are the scrub or the circulate. And mostly, they have scrub techs too. No, ganun kasi ka-complex ang OR comparing sa endoscopy. But there are some OR nurses who does endoscopy too, no? But they don't do any recovery or pre-oping. Yun, that's the difference as well. What else? If you have any questions about endoscopy and what do you need or what you want to know about endoscopy, let me know. Comment down below and try natin sagutin yun, okay? Pay-wise, guys. Pay-wise is just the same. Wala siyang like special rate just because it's a special area. Probably for OR nurses, no? But for for being the special area, no, I don't think. Hindi naman nagbago yung rate ko nung nag-move ako. What's good thing? Siguro, Mama RN, ikaw ba? Sa tingin mo, for pang long term siya, si endoscopy? I believe so. Okay naman si endoscopy, siguro ambulatory. Mas okay kung matanda ka na tapos nag-ambulatory ka kasi wala kang on-call. You don't need to worry about na matawag ka for call shift, ganyan. Oh, guys, before ko makalimutan, sa pain room naman, ginagawa yung mga nerve block, rhizotomy, yung mga may chronic back pain, dyan ginagawa yun. Okay? Bronchoscopy is lungs. If they need to check specific sa lungs ng patient, it's either to flush it or to get some samples. Endoscopy, for those who are not in healthcare, is through your mouth, esophagus, down to your stomach. Colonoscopy is through your rectum. No? What else? Motility. No? Motility lab naman, guys. Meron kaming tinatawag na motility. Sila yung gumagawa ng mga swallow study, pH, Bravo, video capsules, endoflip, para to sa mga may problem with swallowing or laging nagva-vomit, no? Depende sa kung ano yung nirecommend ng doktor. But we call it motility lab. Ma-RN, hindi ba siya sobrang dumi? Kasi kung colonoscopy tapos nagsuscope kayo ng poop, 'di ba? Alam nyo guys, since ako wala rin akong experience with colonoscopy, yan din yung tanong ko noon. Sabi ko, parang kadiri kasi ang dumi dahil kung colonoscopy, puro tae na lang ba yung makikita natin? Alam nyo guys, hindi. Kaya may bowel prep. Okay? Kung meron kang bowel prep na maganda, sorry sa tahol. Kung maganda yung bowel prep ng pasyente mo, hindi sila magdudumi kasi liquid na lang yung lumalabas or naipupup nila. And sobrang clean ng colon nila para ma-scope sila. So, that's the reason why it's important na as pre-op nurse, tatanong mo how it is yung bowel prep nila. Kung clear na ba, watery, or may sediments pa. Kasi, we usually cancel those patients na may form stools pa. Or hindi pa talaga clear, hindi watery yung poop nila. So, we don't scope them kung talagang solid pa yung stools nila. Okay? So, yun yun. Nasa suction naman yung mga juices and may gown naman. So, as scrub nurse, naka-set up ka naman ng face shield, gown, and etc. Gloves, double gloving, ganyan. So, hindi naman. Kasi nung una, ganun din ako. Sabi ko, parang, teka lang, kadiri, paano kung may C. diff yung patient, diba? So, hindi naman, guys. In fairness naman, maganda naman, hindi madumi ang procedure rooms namin. I mean, hindi yung ine-expect nyo na, teka lang, yung poop yung masasuction, talagang poop. No. So, usually, yung talagang yellowish, watery na lang yung nasa-suction. Okay, pasintabi sa mga kumakain. No. So, kaya nga, sobrang mahalaga guys na every after shift ay maligo kasi nga, the atmosphere, no, kahit sabi mo, hindi siya smelly. Hindi siya smelly at all, guys. Pero syempre, kung alam mo ganun yung nangyayari sa rooms nyo, diba? You have to make sure, you want to make sure na naliligo kayo after the shift. Yan. Kaya sabi ko nga sa inyo, sobrang nagdadry na yung buhok ko, nagdadry yung skin ko dahil nga pagpasok, pag-uwi, ako naliligo before. Ngayon, I decided after na lang sa gabi, and then freshen up na lang sa before I go to work. No? Wash na lang ng mga certain areas. Kasi nga, sobrang nagda-dry na yung skin ko, especially winter. Kung summer, okay lang yan. Pero pag winter, yun ang ginagawa ko, guys. So, yun ang ating endoscopy segment number 2. So, if meron kayong mga other questions and anything na gusto nyo malaman about endoscopy, comment down below and let me know, and then sasagutin natin yan. Thank you!